Thank you. Just like the last session, we're going to make this very informal. If you have any questions, please raise your hand, or you can wait at the end, and we'll have ample time for your questions. The talk today is going to be on palpitations in general. And what we're going to try to answer at the end is, when should you be concerned? As many of you know, palpitations are very common. I'm pretty sure all of us here at some point or another have felt some palpitations. And they are so different. And even different patients can describe the palpitations in different ways. And the reason they're important is because they carry a lot of abnormal symptoms. Most patients, I find, describe the palpitations as an uncomfortable feeling in the chest, feeling an irregular heartbeat. They can describe forceful beating of the heart. The usual description is the heart skipping a beat. And when the palpitations are very severe, some people have even described feeling that their heart was going to jump out of their chest. Palpitations can occur with or without heart disease. Now, when they do occur, what are some of the associated symptoms? Well, the discomfort in the chest, like we mentioned. Some folks can feel chronically tired. Dizziness, lightheadedness are seen sometimes. When palpitations are severe, they can even cause someone to pass out. And they can also cause chest pain. Now, this is a slide depicting the normal beat of the heart, and several things need to be mentioned about the normal heart rate. Normally, our hearts will beat anywhere from 60 to 100 beats per minute, depending on what we're doing, the level of activities. And when we're sleeping, the heart rate can go as low as 40 during sleep. And if in well-conditioned athletes, we found that at rest, the heart rate can be in the 40s. That's all normal. The main thing to see on this slide is the heart is supposed to beat regularly. That means the time interval between each beat, as you see on this strip, the interval between each beat is supposed to be normal. Now, you should all really know how to check your pulse, because that can be important someday. There are several electrical digital devices on the market that you can use that will give you your pulse rate. And I know these days all the blood pressure monitoring kits also give you your pulse rate. And you can do it the old-fashioned way by using your pulse and index finger and measure the amount of beats, palpating your radial pulse. And if you count the number of beats in a minute, that will be your pulse rate. Now, what are some of the things that can trigger palpitations? I think the most common offending agent are what we call cardiac stimulants. You know, with the popularity of Starbucks and community coffee these days, ingesting a lot of caffeine can result in a lot of palpitations. Drinking a lot of tea, chocolate can also cause that. Another common offending agent is the ingestion of alcohol. There are a lot of medications that can cause palpitations, both prescribed medication and over-the-counter medications. The over-the-counter ones that are most known for this are the decongestants, the sinus medication, anything that has D at the end, Robitussin D, Allegra D, Mucinex D, all of that can cause palpitations. Prescribed medication can also cause that, especially the thyroid medication. Some blood pressure medications can cause palpitation. And of course, not to mention recreational drugs. People who abuse drugs, cocaine and crack, all of that can cause very abnormal palpitations. Not too uncommonly, the palpitations can be the result of arrhythmias. Arrhythmias are abnormalities in the heart rate that can also cause palpitation, and we'll talk more about that a little later in the program. Now, the fact that you have palpitations, do you need treatment? Well, not necessarily. Most of the time, these palpitations are benign and don't require any specific treatment, but they should not be ignored. You should still seek an evaluation by your doctor. And after you checked, if your doctor determines that your palpitations need to be treated, the treatment usually will depend on the underlying cause. If your palpitations are due to, let's say, ingesting too much coffee, too much tea, then I'm pretty sure he'll get you to decrease that consumption accordingly. If it's due to alcohol intake in kind, he'll get you to decrease that intake. And if your palpitations are severe and they cause a lot of adverse symptoms, then there are several classes of medications that can be used either to suppress the amount of palpitations or to eradicate them altogether. The most commonly used classes of medications are the beta blockers and the calcium channel blockers, and these two groups are also blood pressure medicines. So if you do have high blood pressure, it's pretty easy to kind of kill two birds with one stone and give you one medication that's going to control your blood pressure and heart rate at the same time. We also use another medication called Digoxin. And in extreme cases of palpitations, we even use more sophisticated medications called antiarrhythmic, which may help control your heart rate. So as I mentioned earlier, sometimes these palpitations may be due to arrhythmias. Arrhythmias are abnormalities of the heart rate. And let's go over some of the most common ones. We have, let's take the second one, PACs and PVCs. Those stands for premature atrial contraction and premature ventricular contractions. These are usually single extra beat that disrupt the normal rhythm of the heart and can be felt as a thumping in the chest. And a lot of times they are asymptomatic. You may not feel them at all. Sinus arrhythmia, the next one, is an arrhythmia that's very common in children. In fact, almost all children have it. We usually outgrow that by the time we get into the 20s, but in some folks it can persist into adulthood, and that can cause an uncomfortable feeling in the chest, like the heart rhythm is not normal. Supraventricular Tachycardia, or SVT for short, is a little bit more complicated. This is an arrhythmia that's common in the younger age group, and this usually comes with a lot of symptoms. Typically what happens, the heart would jump from its resting rate of about 60 to 80. It would suddenly jump to a rate of 180, sometimes up to 220. And that's usually associated with a lot of anxiety, feeling of fullness in the chest, shortness of breath. And in extreme cases, it can even cause fainting, syncope. The person may pass out. Of course, the most common arrhythmia is atrial fibrillation, and that deserves special mention here. And this is one slide showing you the difference between a normal heart rate and atrial fibrillation. As I mentioned before, normally your heart is supposed to beat at regular interval, and as you can see on the second strip, in atrial fibrillation, the heart rate is erratic. The time interval between consecutive beats vary with no rhyme or reason, and most of the time this is symptomatic. You will feel some symptoms and the abnormal heart rate. Now, why is atrial fibrillation important? It's important, one, because it's very prevalent. If you look at the epidemiology of atrial fibrillation, we have about 2.5 million cases in the United States. It's very common. It's an arrhythmia that's mostly found in the older age group. It's the most studied arrhythmia. We call it the grandfather of all the arrhythmias because we've known about that for 140, 150 years. And it's also the arrhythmia of grandfathers. It's mostly seen in the older age group. What are some of the things that can lead to atrial fibrillation? Well, all of the things that we said could cause palpitations before. The stimulants, the caffeine, the alcohol, the medications, all of that can also cause atrial fibrillation. But in addition, the most common cause of atrial fibrillation is having high blood pressure for many years. Hypertension is the most common cause. Atrial fibrillation can also result from structural heart disease. If you've had any problem with the heart valves, if you've had heart attacks, an enlarged heart, a weak heart, all of that can cause atrial fibrillation. Thyroid disease can cause atrial fibrillation. It's usually the hyperactive thyroid. If your thyroid is hyperactive, that can cause atrial fibrillation. If your thyroid is underactive and you're getting thyroid supplement, if the dosage is a little bit too much, that can cause atrial fibrillation. Sleep apnea is another common cause. And with the endemic of obesity that we hear on TV, sleep apnea is getting to be more and more recognized, and that can cause atrial fibrillation. And usually the treatment of the sleep apnea with CPAP and extra air when you sleep, that can suppress the recurrence of atrial fibrillation. And not to mention the pulmonary diseases, or almost all of them, the COPD, emphysema, pulmonary embolism, even asthma. And the treatment we use for pulmonary diseases, the epinephrine, the bronchodilators, the Atrovent, Combivent, albuterol, all of that can cause atrial fibrillation. Now, why is atrial fibrillation important? It's important because if it's left undetected or untreated, it can cause a significant amount of stroke. In fact, the stroke rate in patients with atrial fibrillation, depending on several other factors, depending on the age and whether or not they have high blood pressure or congestive heart failure, the stroke rate can vary anywhere from 1 to 18%. So because of the significant morbidity that can result from a stroke, atrial fibrillation is important, and if it's present, it should be detected and treated. Atrial fibrillation has two major issues, two major problems with the heart rate and rhythm. One, the heart is beating too fast. Second, the heart is beating irregular. So these are two problems. One, the heart is beating too fast in atrial fibrillation. Second, it's beating irregular. Because the heart is beating too fast, if you have atrial fibrillation for a significant amount of time, the heart beating fast for 2 to 3 months can weaken the heart. You can wind up with a heart that's very enlarged and weak just because it's been beating too fast. And that can lead to congestive heart failure. And in rare cases, and this is not common, atrial fibrillation can even trigger a heart attack. It can cause you to feel very tired to the point where just walking from your bedroom to your bathroom, you may feel drained and short of breath. So it causes a lot of morbidity. Because I've mentioned the incidence of stroke in atrial fibrillation, I think you all should be concerned about the stroke warning sign. If you have any sudden onset of neurological deficit with sudden inability to speak, sudden confusion, sudden weakness on one side of the body or the other, those things need to be addressed emergently. Now, how do you know if you have atrial fibrillation? Well, believe it or not, some people have atrial fibrillation and don't feel a thing. They may not know it. They're not aware that their heart is beating fast or irregular. But most of the time, you'll have some kind of symptoms. Most people will feel that their heart is beating fast, beating out of rhythm. It can present as fullness in the chest, shortness of breath, extreme fatigue. And in rare cases, if the heart is beating very, very fast, atrial fibrillation can even cause you to pass out. Now, is atrial fibrillation an emergency? I would say in the majority of cases, it's not. When we do see patients when we see patients in the office with atrial fibrillation, remember we have to address two problems. The heart is beating too fast. Second, the heart is beating irregular. The irregularity in the heart is what causes the stroke. So if you see someone with atrial fibrillation, we will always put them on blood thinners for stroke prevention. And if the heart is beating too fast, we can use one of the medications I mentioned earlier for the palpitations that slow down the heart rate, either the beta blocker, the calcium channel blocker, or the digoxin to correct the fast heart rate. Always remember that. Two problems: the heart is beating too fast and it's beating irregular. So it's really never an emergency, atrial fibrillation, and it can easily be treated. But in rare cases, the atrial fibrillation may need to be corrected immediately. If you have atrial fibrillation with a very fast heart rate and you're having angina, which is the pain you get from your heart, or if you're having congestive heart failure, then that atrial fibrillation needs to be corrected immediately. Then we can use a procedure called a cardioversion. You know, this is similar to what you guys see on TV sometimes on ER and Grey's Anatomy when they're rushing with the defibrillator and shock somebody. That's one of the treatments we use to correct atrial fibrillation in a hurry. Now, we've talked about palpitations, atrial fibrillation, and I just wanted to make sure that you guys understand these involve the electrical system of the heart. So when we talk about heart attacks, we are actually talking about the plumbing, the vascular system of the heart. So atrial fibrillation and palpitations are different. Now, the question I presented in the end, the question I presented in the beginning, should you be concerned? As you've heard, most of these palpitations are benign and most don't require any specific treatment, but not too infrequently. These palpitations could be the warning sign of more serious heart diseases and should never be ignored. So whatever the palpitation, I would urge you to at least seek an evaluation with your physician, because it may mean that there is something drastically wrong. Thank you. I'll stop here. If you have any questions, we'll entertain them now. Sir? Well, it depends on how low it is and for how long. Because if you do get the medication to drop your heart rate and it drops it too low and your blood pressure goes low, usually that may be associated with decreased perfusion to your brain, and there is the potential at least to have some brain damage and have some complications for that. But if it's only for, let's say, a few minutes, then that's usually not a problem. Yes, sir?
The term murmur, I have heard a doctor that maybe an internist with a stethoscope. You sound like you got this part murmur.
Yeah.
What is that?
Well, usually, as you know, when the blood flows through your heart, you have four major valve systems in the heart. So when the blood flows through the valve, if the valve is not open fully, then there is a lot of turbulence, and the blood actually makes a noise going through the valve. That noise is what we call the murmur. A lot of children have murmurs and outgrow them, and in adults, it's not uncommon as we get older, because the valves become stiff. And I tell most people, just like our knees, our joints, as we get older, become a little stiff. So it's not uncommon as we get older to have a slight heart murmur. As long as it's not severe, those usually don't require any specific treatment. Sir?
If your heart skips a beat, but it's not a regular thing, you know, it might be one time and maybe 10 minutes later before it does it again. Is there a system or something like that that you check it?
Yeah, there is a system to check it. Generally, what we would do is we have monitors that we can put on patients for 24 hours to see, one, how many of these skip beats that you have. And the thing that's important, remember that you may not feel every bad thing that your heart is doing. So sometimes you may feel one skip beat when there are actually 10 and the other 9 you didn't feel. So when we do detect these abnormalities, we want to get a sense of how much dysfunction there is. And the good way to do that is by monitoring your heart for 24 hours and see how many times it skips throughout the day. Whether we do anything about that will depend on a lot of other factors. Let's say if you've had heart attacks before, if you've had heart failure, if we know your heart is weak, if you're taking some medications that predispose you to arrhythmias, to an abnormal heart rate, so that we would look at with a little bit more scrutiny. Okay. Yes, sir?
Children having a hole in the upper chamber or lower chamber is related to this?
Well, usually the holes between the upper chamber of the heart, depending on the size of the hole, we call that either an ASD, atrial septal defect, or if it's very small, it's usually a PFO, patent foraminovalve. That may or may not cause you to have palpitations or arrhythmias. The problem with the hole, we all born with that. Everybody is born with that hole in the heart. It usually closes within the first 3 days of life, but in some people it remains open, and that can lead to increased pulmonary pressure, enlargement of the heart. Depending on how large that hole is, if it's causing some cardiac abnormality, it can cause irregular heart rate. But most of the time it's so small that unless we look for it, we don't even know that it's there. Well, the way that we would determine, I don't think there is any direct way to go and measure it, even though I do some special testing sometimes going through the mouth with an ultrasound where we can measure that. But the way we would determine whether it's a small hole that's insignificant is measuring your pulmonary pressure. Because if it's significant, then the high pressure on the left side of your heart would be transmitted to that hole, through that hole to the right side of the heart, and the right side would be enlarged, and the pressure on the right side would also increase. So there are some indirect way we can know whether or not it's significant. But if you're somebody who can do physical activities, you can run, you're not short of breath, and your heart is not enlarged, then we know that it's too small and it's not significant. It sounds like it's raining outside, so we're not going anywhere. So, sir?
I have I guess I would call it a friend that I've known for years. There's always comments about the palpitation he has. It's a little unusual, I guess. You can do something in like dirt, playing tennis in dirt.
Yeah.
You start getting that palpitation. And then you can relax and rest and it'll go away.
Yeah.
I come back again, but it's just something I feel out of bed one morning. Is there a system or is there something that the person can do? Or it's kind of like having something show up on your car. If you don't go to the mechanic who's happening, you can't say what it is.
Yeah, and there are several ways now we can detect that. You know, as I mentioned earlier, we can put a heart monitor that will monitor his heart rate for 24 hours. So we have monitors that can record the heart rate for 3 weeks. So what we potentially can do is put the monitor on and tell him to go play tennis. And believe it or not, now things are getting so sophisticated. We have implantable monitors that can detect your heart rate for 3 years. So even though he's been having it for years, I would certainly recommend checking into it. Let me tell you, I've had people who tell me that, you know, I've had these palpitations all my life, and when you do the investigation, you find that it's the dangerous kind that they have, and they really need specific treatment to prevent it, because some of these palpitations can be associated with, you know, bad outcomes. And the fact that they've had it for years, we cannot always be sure that the palpitation he was having 10 years ago is the same one that he's having now. Sir?
When I have an EKG, it's always in the regular EKG, and I get 3 turns. When I heard 3 turns over the last 30 years, well, ischemic, long block, and a thyroid like that. Explain that.
Yeah. Well, bundle branch block is a little bit easy to explain. Usually from even from this picture you can see, I think we have another one in the beginning. From this picture you can see you have 2 larger chambers on the bottom and 2 smaller chambers on top. So this constitutes the right side of the heart and the left side of the heart. And these 2 sides of the heart should beat in synchrony. They should beat at the same time. They should depolarize and contract at the same time. Now, if they do contract at the same exact time, then the tracing that you see on top, you see the little lines, that tracing that you see on top will be very narrow. This is like looking at 2 things that are happening on end. The tracing will be narrow if both sides are contracting at the same time. Now, if you have any kind of enlargement of one side of the heart or the other, increased pressure on one side of the heart or the other, there is a delay in contraction, so they don't contract at the same time. So that tracing on the EKG will appear wide. And there are ways electrically to measure that. Usually, if it's more than 100 milliseconds, then we say you have a bundle branch block.